Hello and welcome once more to my channel, Background Health. On today's episode, I'll be discussing acute kidney failure, which means sudden kidney failure. This is very common and virtually everyone is at risk to develop acute or sudden kidney failure at one time or the other. However, there's no need to despair. This type of kidney failure is so common, but does not always need to go into dialysis or even require transplant. However, if you neglect it, if you don't seek attention at the appropriate time, it may lead to chronic kidney failure and you may eventually wind up needing dialysis or even transplant. What is the name of this type of kidney failure? It's called acute kidney injury, AKI. It used to be called acute kidney failure. What causes it? Well, several things. Number one, dehydration. If you become dehydrated for one reason or the other, you can find yourself going from having normal kidney function one day and 2, 3, 4 days later, you develop kidney injury or acute kidney failure. Whether that is due to severe nausea, vomiting, or purging, as it's called in some countries, or whether that is due to extended or prolonged episodes of diarrhea, or whether this is due to simply not eating or drinking enough fluid when you are sick or when you are fasting. Regardless of what causes, dehydration means that your body has less blood volume to supply your kidney. And when that happens, the kidney begins to shut down in order to sacrifice the kidney for the benefit of other organs, especially the brain. Other things that can cause this type of dehydration could be diuretic medication that you are taking for congestive heart failure or for some high blood pressure medications. That include furosemide, that include hydrochlorothiazide. So when you are at risk of dehydration, vomiting, diarrhea, fasting, not eating enough, if you're taking diuretic, hydrochlorothiazide, furosemide, or bumetanide, you need to hold it. Other things that can cause it include direct injury upon the kidney itself. What do I mean? For instance, some people take drugs such as cocaine or amphetamine. Those can cause direct injury to the kidney itself. Other things could be accident. You have a massive accident or crush or injury to your muscles, and your muscles release some chemicals, which then go to the kidney and cause injury to the kidney. Or you may have a test, such as CT scan in a hospital, and as part of doing that test, the doctor may give you something called contrast. Those contrasts can cause injury to your kidney and cause acute kidney injury. Alternatively, there are some medication given to you in the hospital, such as antibiotics, like antibiotic called gentamicin or vancomycin, or broadly speaking, a group or family of antibiotics called aminoglycosides. Another group of medication that can cause severe acute injury to your kidney include chemotherapy for those who are taking chemotherapy. Other medications that are very, very common, which may be in your medication cabinet, include blood pressure medications such as lisinopril, losartan, captopril, enalapril, etc. Please check your medication cabinet to see if you're taking any one of those medications. Another group of medication that can cause direct injury to the kidney include anti-inflammatory medications such as ibuprofen, naproxen, indomethacin, commonly seen in certain trade names such as Aleve or Motrin. So please check your medication before you take them. Now, the next big category of causes for acute kidney injury include obstruction of urine flow. For men, the most common cause of obstruction is enlarged prostate. Other causes in men could be stricture, which means scar tissue at the urine output, meaning between the bladder and the penis. If you have a stricture or scar tissue, commonly due to previous infection, which includes sexually transmitted diseases that can also cause kidney failure. Or in women, tumor, such as very large fibroid or ovarian cancer or any type of pelvic tumor in women can cause obstruction of outflow. Similarly, they can also develop blockage of urine flow due to stricture from previous infection or due to previous surgeries such as C-sections or other gynecological procedures. So, although those type of things are common, once they are detected, reversing the condition, such as relief of the obstruction, can reverse the kidney failure. Altogether, acute kidney failure does not have to lead to chronic kidney failure if it's treated promptly. But to treat it promptly, it has to be diagnosed promptly. Sometimes, if it goes after 4, 5, 6 days and you have not done anything and the condition that is causing it persists, it can progress to the point that you have an irreversible damage to your kidney. So, in conclusion, acute kidney injury or acute kidney failure is very, very common. But the good news is that it is usually very reversible once you detect the cause of it, treat it, take care of it. But if you don't seek medical attention, if you are sick and you don't see a doctor, then it will not be diagnosed and it will not be treated. And before you know it, you wind up with chronic kidney failure, seeking dialysis or taking transplant. So please take care of your health. Be healthy. Until next time.